Thank you very much, Monique, for kind words. And hello, everyone. And it's such a huge privilege for me to be here. So thank you, Sean, for inviting Harm Reduction International. So I'll be talking today about the 10 by 20 campaign and harm reduction. So I'll briefly explain, so I'll start by briefly explaining what the campaign is about and why do we need action, and then I'll focus on harm reduction from the global point of view, and then I'll speak a bit more about funding crisis for harm reduction, and I will finish by describing potential of the 10 by 20 campaign and what can be achieved. So, what is the 10 by 20 campaign about? Well, it's a pretty straightforward, easy and simple campaign. And basically, we are calling on governments to redirect 10% of the money that they are currently spending on ineffective and very often abusive drug control to harm reduction, and to do it by 2020. Hence the name of the campaign, 10 by 20. Well, I have a slide explaining what harm reduction is exactly about, but I think that everyone here knows exactly what harm reduction is, so I'll just skip it. So why do we need action? Well, there are two main reasons why do we need action, at least from the campaign's perspective. First of all, as you can see from this slide, it's because harm reduction works, and we know that harm reduction works. We know it since 1980s, since it was started in the UK and in other Western European countries. It's over 30 years now that we know that harm reduction works. We know that harm reduction saves lives, and we know that harm reduction is cost-effective. The second reason is, as well, that it has been mentioned many times here today, we know that war on drugs failed. We know that war on drugs doesn't work. And as you can see from the slide, yet a whopping $100 billion is spent each year on drug control. $100 billion. And we think that this figure is hugely underestimated anyway. On the other hand, as you can see from the slide, only $160 million is being spent on harm reduction. It's a huge, huge difference between how much is being spent on war on drugs that completely failed and harm reduction that is saving lives. So that's the second reason. Well, actually, I just want to add one more thing to this. It's not only civil society point of view, but it has also been recognized by the UN. And in the last few years, UNAIDS published a report that said that between 2010 and 2014, only 3.3% of HIV prevention funds went to programs for people who inject drugs. 3.3%, it's a very, very small figure. So let's have a look at the global state of harm reduction. So just to show you as well, every 2 years, Harm Reduction International is publishing this report that is called The Global State of Harm Reduction, and we are looking at the last 2 years on 158 countries and what happened in this 158 countries harm reduction relating. So as you can see, in 2016, out of 158 countries reporting injecting drug use, 90 implement needle and syringe programs, 80 provide opioid substitution therapy, 9 have at least one drug consumption room, and stimulant use is increasing in each region of the world. So it's a good picture. If we look at it, the majority of 158 countries with documented injecting drug use have adopted harm reduction measures to some degree in domestic policy and practice. But what I want to caution here is that even though we say it's 90 countries implementing NSP or 80 countries implementing OST, it's not coverage. So you can have one country just with one NSP or one OST. It doesn't mean that it reaches enough people, but at least it's in the policy. I can't change it. Oh, it's now. However, since 2014, we've noticed a worrying trend. So as you can see on the slide, what has happened since 2014 is that 0 new countries implemented needle and syringe programs. Only 3 new countries now provide opioid substitution therapy, and it's Kenya, Senegal, and Monaco. Only 2 new drug consumption rooms have opened, and I think actually the number is 3 because I think we didn't include the one in Paris. And again, the stimulant use has increased in every country of the region. And there is one more thing as well that happened recently that is not included in that slide, and it's between 2011 and 2015, new HIV infections among people who inject drugs have increased by 1/3, despite a UN target to halve new HIV infections among people who inject drugs in the same period of time. So in 2011, member states signed political declaration on HIV and AIDS that promised a new target saying that we will halve HIV infections. Not only that target has been completely missed, but new infections are on rise among people who inject drugs. So just to recall what I've said is, since 2014, harm reduction programs have stagnated, stimulant use has increased in each region of the world, and infections among people who inject drugs are on rise. So if the picture was not bleak enough, here is a slide showing drug-related overdose deaths in some countries. And as you can see in Canada, since 2008, increase in drug-related overdose deaths is 327%. In the US, 137%. In the UK, in the last 2 years only, 64%. An increase in Australia since 2004 is 61%. So if the picture was still not big enough, I'll speak about harm reduction in prisons. So with harm reduction stagnating in the community, with things look particularly inadequate in prisons as well. Currently, only 8 countries implement needle and syringe program in at least 1 prison, while only 52 provide opioid substitution therapy. And this is happening despite the fact that up to 90% of people who inject drugs will be incarcerated at some point in their life. And although there has been some momentum around decriminalization as well in the last few years, mass incarceration continues to be a favorite approach to drug control, and globally, 1 in every 5 prisoners is held on drug-related charges, and the vast majority for personal use and possession. And nowhere in the world the human consequences of these figures are more striking than in the US. And Human Rights Watch recently revealed that 1.25 million arrests for drug possession were made in the US alone. That's 1 every 25 seconds. And that's just a quick snapshot of availability of NSP and MST in sub-Saharan Africa. That's according to our data. So if you have other information, then please do come and let us know as well. But according to our data, there are only 5 countries that provide OST and NSP, and these are Senegal, South Africa, Tanzania, Kenya, Mauritius, and Seychelles provide OST. So why is there a lack of funding for harm reduction? Well, I could spend the whole day actually discussing this topic because for some weird reason I like it. But I'll cover just few of them here. We know that bilateral and multilateral donors are shifting away from middle-income countries to low-income countries, despite the fact that 75% of people who inject drugs live in such countries. We know that overall donor government spending to address HIV in low and middle-income countries declined in 2015 for the first time in history. We know that there is a huge lack of political will. National governments often don't prioritize and invest in harm reduction, and in many places services remain small-scaled and NGO-driven. There is an expectation as well that upper middle-income countries will fund their own harm reduction, but then it goes back to lack of political will, so we are basically in vicious circle. And there is as well financing and leadership coming from the UN, but I know that Jamie Bridge will be talking about that in next session, so I'll just skip it for now. So what is the resource needs? Well, there has been few studies done. In 2011, UNAIDS said that 2.3 billion is required by 2015 to fund HIV prevention. This has not been achieved. Then they came up with another figure, 1.5, that we questioned. And that's why for our report from last year, the Case for Harm Reduction Decade, HRI worked with the Burnett Institute from Australia, with Professor David Wilson, who also works with UNAIDS and the World Bank, to mathematically model the potential of harm reduction from now up until 2030 with different funding and coverage scenarios. And this is basically what we came up with. So we need 2.5 billion for medium global coverage of NSP, OST, and IRT by 2020, and 7.5 billion is needed for high coverage by 2020. But now, as you remember, I said at the beginning that $100 billion is spent each year on the ineffective war on drugs. So the question that we had actually was, if we redirect just a tiny little bit of money from war on drugs to harm reduction, what can we achieve? How many lives can we save? So these are the results. So if we redirect just 2.5% from the 100 billion, what you can actually see is by 2030, HIV-related deaths will go down 65%, and new HIV infections will go down by 78% by 2030. And that's only with 2.5% of money redirected from war on drugs to harm reduction. If we redirect 7.5%, what you can see is basically HIV-related deaths will go down by 93%, and the new HIV infections will go down by 94% by 2030. What that means is basically we can virtually end AIDS among people who inject drugs by 2030 with a small redirection of money from war on drugs to harm reduction. And 2030 is a crucial year as well because of Sustainable Development Goals, and Sustainable Development Goals have a very little one nice target there saying that governments should end AIDS by 2030. What is other potential of the 10 by 20 campaign? We not only can finish end AIDS by 2030, but we can as well use this money to strengthen networks of people who use drugs. We can roll out naloxone, we can cover annual Hep C prevention need for people who inject drugs. And you can invest this money in anything that you think you need or is necessary for your community. So just really quickly, who endorsed the 10 by 20 campaign? In Kuala Lumpur, in 2014, we had a conference there, and we released a declaration, the Kuala Lumpur Declaration, that has 10 by 20 included as one of the recommendations, and over 1,500 people endorsed the declaration, including Ruth Dreyfus, the former president of Switzerland, Kofi Annan Foundation, Richard Branson, and IJAF, Elton John AIDS Foundation. UNAIDS recently added the 10 by 20 ask to their report. Basically, they said they recommend governments to undertake a rebalancing of investments in drug control to ensure that resources needed for public health services are fully funded. And the same is recommended by the World Bank and WHO. I think I only finished here, but yeah, thank you very much.